Hi lovelies, and welcome back to this channel. If you are new here, my name is Belinda Strana. Thank you so much for all the love and support. Don't forget to please subscribe to this channel, turn on notifications so that anytime I upload a video, you will be the first person to be notified. And to my returning subscribers, thank you so much for all the love and support. To those people that share my videos, that leave commentaries, and also educate you guys are the real MVP. Thank you so much for all the love and support. Alright lovelies, let's dive into today's video. So lovelies, I came across this video on my For You page on TikTok, and as usual, I thought to share with you guys where this pan-colored doctor, he's actually a doctor, decided to ask the black community this particular question that actually got a lot of people giving him answers from left, right, and center. Guys, I'm just gonna roll the clip as well as some of the stitches I was able to get from black people replying to his question. All right, lovelies, let's get into the videos.
As a racist, I've gotten backlash before online, and it's horrible. But here we go. I've been an ear doctor for 10 years now, and a significant amount of my African American patients, while I'm doing a history and physical to understand better what's going on with their problem today, they have someone on the phone. They're either just talking on the phone or they're on FaceTime, but a large percentage of my African American patients have someone that's there in the room even though they're not there in the room. Why is that? When I, myself, not speaking for an entire race or ethnicity, have a doctor come in, I hang up my phone. Am I an outlier, or is this a trend that other people have recognized?
Beyond the fact that you literally just opened up the floor for racism in your comment section, whoop-de-doo for you, I'll answer. We don't trust y'all. As someone who has been chronically ill for a very long time, I learned very early on in my life as a child and going into adulthood that there were certain points where I could not go to the doctor and not either have someone in the room with me or on the phone with me. Because the way so many doctors, especially doctors, go out of their way to gaslight you, to condescend to you, is insane. And many of my worst experiences have been when I was unable to have some type of advocate in the room or on the phone. At some point, y'all are gonna have to stop asking why we operate differently within a system that wasn't created for us. Many of y'all, to this day, still do not believe that black people experience pain to the same degree that white people do. I mean, we literally have just been dealing with the drama from a black healthcare professional telling black women that they cry wolf at the doctor. And y'all wonder why we come in and make sure that we're not completely alone? Are you kidding me? The rate at which medical professionals choose not to believe us, choose to gaslight us, and choose to lie to us is beyond heartbreaking. And therefore, you will never catch my black ass in a doctor's office without somebody there to listen. And I don't care how you feel about it.
Story time. This video has been all over my For You page for the past few days. The original video is unavailable, of course, and an apology has been issued, of course, but I thought that this video would be a great prelude to my personal story. So let's get into it. If this is your first time seeing my video, my background is in nursing and public health, specifically women's health nursing and maternal and child health. A part of that area of focus is breast health. Now that's important, so keep listening. If my knowledge couldn't save me, imagine what happens to the general public, which is why it's important, and I'm always going to advocate for black people to take someone with them to the doctor, whether it be a family member, a friend, a neighbor, someone, because you're going to need someone as a second set of ears and to bear witness. So almost 3 years ago, I was diagnosed with breast cancer. The treatment that was best for me based on the type of breast cancer that I had was a bilateral or double mastectomy, meaning that both breasts would be removed during a surgery. Prior to even going in to meet with my breast surgeon, oncologist, or plastic surgeon, I had already done tons of research. I had a foundational level of knowledge, but I did additional research to make sure that I was choosing the best possible outcome for myself after treatments. So I went in, I met with them all, I listened to what they all had to say, and then I said, well, based on what you've shared and based on what I know, given my background and the research that I have done, this is what I want to do. And they agreed. For each and every visit that I attended, and there were several, ultrasounds, MRIs, guided MRI, biopsies, mammograms, consultations, an extensive amount of appointments over the course of 3 months. For every appointment that I attended, I had my wife or my mother there with me, whether it was in person or on a FaceTime call. Going into this, I was a C cup, a very small C cup, had been a C cup since I was a teenager and never grew beyond that point. This is important. At each and every visit with the plastic surgeon, I expressed that I wanted the reconstruction, meaning the implants that were put in after the breast tissue had been removed, to not be any larger than what I was before. I wanted to have the same aesthetic when I looked at myself in the mirror and when I put my clothes on my body post-surgery. We were in agreement. He told me the different types of implants that could be used and that he would be sure to match my breast size, which was a small C cup. I have the surgery. I wake up from surgery. I'm taped down. I am in a compression vest. It's really hard for me to see what size breast I have because there's swelling and a whole lot of other factors that play into it, but I knew that I had breast forms in place. As the weeks go on, the compression bra comes off and I'm able to finally start to see what these new breast forms look like. Now there is still some swelling, but in my mind, I'm thinking these look extremely large. Could it be the swelling? I asked the plastic surgeon about the breast size and I say, well, there seems to be a lot of swelling. When will this swelling go down? Because these seem very large, they're very uncomfortable, and I'm not even able to sleep because of how large these breasts are. He smiles and gloats and tells me that he decided to give me a larger implant because he felt that my body structure, my aesthetic could handle it. Besides being flabbergasted and angry in the moment, when I finally went to get size to see what my new breast size was, after I was healed enough to have that process done, turns out my new breast size is a full double D. So here we are, almost 3 years later. The implants are so large that not only have they caused the remaining skin to stretch, but it's also caused the remaining skin to thin out. And as a result, I'm having to undergo a new surgery, so a reconstruction and a revision of the implants because the skin that was left on my breast can no longer handle the size of these implants. For the past 3 years, I have dealt with the extreme size of these breasts. Now, over the last 6 months or so, the thinning of the skin has occurred, which has caused pain and just a disfiguring of the breast beyond any scarring that was left due to the mastectomies. I'm undergoing a revision and a reconstruction of the breast and having new, smaller implants put in, but this should not even have been my journey or my story. If my wishes were just respected, we would not be here less than 3 years later. This white male doctor took it upon himself while I was under anesthesia and unable to consent to increase the size of my implants, even though we had spoken several times and I explicitly expressed what my wishes were regarding the size of the breast implants that were put in to reconstruct my breasts after having breast cancer and double mastectomies. This is the reason why we, people who look like me, bring witnesses with us to the doctor. Yes, there is recourse, and that plastic surgeon is being held accountable, but we shouldn't even be here.
J Doctor, they killing me. Nicki Minaj 2014. The girls that get it will get it. But for the girls that don't get it, for the girls that are not thinking with their third eye, for the girls that are not thinking at the fourth dimension, the healthcare system and the justice system are parallel in terms of how they treat black people. In fact, there have been so many anecdotal cases, this mistreatment happening in healthcare. Literal studies were conducted, and their findings, let's just say nobody was lying. So yes, don't act shocked. One thing about us, we're gonna have our entire family on the phone, Facebook Live on our iPads, and the NAACP on email, because we have to be real. Some of y'all like to lie, and it's not just with doctors. Everybody think of two of the most vile human beings that you went to school with. Are they a nurse right now?
This right here is a prime example of why I think there are certain professions that should not be allowed to make monetized content online utilizing their professional identity, especially if that professional identity has an ethical code that they have to uphold. He didn't ask this question in good faith. Oh, I have a question, and I'm just a white guy asking a question. Black people, you know, those blacks, they're just so hard to figure out. He asked this question for the sole purpose of going viral. He knew exactly what to say. That's why he prefaced that video in the beginning, because he knew that he could get your attention. He's going to ask this dumbass question because he knew it was going to generate content. He posted the same video on his Instagram, has the comment section wide open and got people going back and forth. He knew what he was doing. The man who went through a medical school program within the last 20 years, he should not be asking this question. If you're going to ask this question, why would you ask it of the internet? Be serious.
So he basically says in the video that he wants to know why a lot of his African American patients bring somebody else in the room, even though that person is not like contributing to the conversation or whatnot. They'd be playing on their phone or whatever. And I will tell you the answer. Is mistrust in the medical system, because doctors do not believe a lot of their African American patients. Now, there are tons of studies and tons of articles that you can find online. One of them is aamc.org, and the article is called How We Fail Black Patients' Pain. Now, this article was written in January of 2020, okay? So, you know, not too far back. Now, there are quite a few lies about Black patients and our pain. For one, a lot of us experience doctors that don't believe us. There's a study that shows that Black people were 22% less likely to receive pain medication as opposed to a white person. And hell, there was one time when I had a blood clot that traveled upwards and I was in so much pain, they would not give me any pain medicine. But the old white lady next to me who was walking, she said, "Oh, I fell and my back hurts." And I heard them, "Oh, we'll give you some Percocet." There's also a study that shows physicians were more likely to underestimate the pain of Black patients, which is 47%, relative to non-Black patients, 33%. There are still medical students who believe that Black people have thicker skin than white people, that Black people have a different pain tolerance than white people, and that's why they don't prescribe medications and whatnot. And this dates back a long time of white doctors not believing Black patients, or even worse, white doctors performing procedures on Black patients without any anesthesia or anything like that. There is a man who's considered the father of gynecology, and what he did was practice on enslaved women and with no pain medication. That's great, isn't it? Hell, when I had a stroke, my husband got me to the hospital in like record time, and he ran in apparently, got a doctor or got a nurse, and they came out to the car to try to get me because I was slumped over. And he's telling them she had a stroke, these are her vitals, blah, 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 because he used to be a paramedic. And they just kind of brushed it off. They said I was drug seeking. And then they decided, oh, we're going to do a lumbar puncture. And they did it wrong and messed up my back because I have degenerative disc disease. So even though I was having a stroke, even though I couldn't talk and I was just slumped over, these doctors honestly believed that I was faking it and they would not give me anything. A few years later, when I had a subdural hematoma after getting a procedure done on my back, basically the spinal fluid leaked and that caused a lot of pressure in my head. And I literally could not sit up. So, you know, I call my pain management doctor. They're like, oh, you just need some caffeine. It will get the headache away. That did not work. Then they said they're going to do a blood patch, which is like they inject your blood into your spinal column or something like that. And that worked for a few hours. But at the point where I was at my mother's house for a barbecue and I was laying on the floor And they were like, okay, food's ready. And I did not want to eat. My family knew there was a problem and they were like, get to the hospital. So we're at the hospital and I'm sitting there and I'm laying down and I'm saying, listen, the pressure in my head is so bad and I'm so nauseous. Can we just stop the pressure? And they gave me the anti-nausea medication, but not anything else. It wasn't until they did the MRI and they saw the big black line in my brain, which was the blood, that they like basically said, oh shit, this is serious, and then put me on a dilaudid drip. And I was hospitalized for like 4 days. I was on dilaudid and all that. But the point is, I have been through some shit, and damn near every doctor that I have seen has not listened to me, has not, trusted me in what I'm saying is happening with my own body, and they just are dicks. Like, that's it. So the reason why a lot of African American patients bring somebody in the room is so that we can have a witness of what the doctor is doing or not doing, actually, and, somebody to advocate for us if we need it. Basically, the medical system is still racist and holds a racial bias against Black people.
Have you simply tried asking your patients before asking a social media platform? I'm an OBGYN. Whenever I notice that patients are on the phone, I simply ask, hi, I'm your doctor. Who's not on the phone with you? Okay, would you be comfortable with me asking medical questions while they are still on the phone, or would you like to hang up? And it's the year 2024, and I don't know how to gently say this. Other people are a little bit more vocal, but why is it that you're asking a whole social media platform when it comes to race? You are actively taking care of patients. I don't know where you're working. I don't know the patient population that you're serving, but I am concerned that you are now overgeneralizing a whole race in terms of utilizing their phone while on a visit with you, and you can't talk to your patients directly.
A lot has been said about this video. I'm not going to repeat that. I do want to mention 3 things though. 1, he's getting ratioed. Love to see it. The comments are higher than the likes. Love it, love it, love it. 2, if anyone's interested, I know he's not, based on the beginning of that, medical apartheid. Honestly, you don't even have to read the book. Just read the table of contents. Google the phrase medical apartheid. This is not for him. We know he doesn't give a fuck. Also, thirdly, he posted this shit on Instagram too. He don't give a fuck.
First off, too late, buddy, because you're going to the internet instead of talking to any of your Black colleagues, looking at any of the research around things like Black infant mortality or maternal or gestational mortality rates. I mean, you could also just look at media and look at Serena Williams' interview about her experience with pregnancy and how she almost died. And she's rich. But instead of acting like you could have done any of those things, let me give an example. Early in 2023, I fucked up my rotator cuff in my shoulder. It was at a level that holding my cell phone felt painful and my arms were visibly different lengths hanging against my body. And I was in pain 24/7. I reached out to my primary care physician, who simply told me to ice it and take aspirin, because he didn't think it was worth an MRI to see if there was an issue. 2 weeks and a lot of customer service complaints later, I had rotator cuff injuries in 2 different parts of my shoulder. I always bring folks with me now.
I have a question, but I'm afraid to ask it because I don't want to be...
Seriously, Lovelace, when I see people like this, I already know where these questions are coming from and where it is expected to go to. So even before he started asking this third question, he began by saying that he has, encountered some kind of backlash, asking some type of question that, resulted him having backlash from, as usual, Black people. And but now he also want to ask a particular question, and he did not also care to get a backlash. And you know what? He actually got what he was clamoring for. But I don't know why these people keep on doing stuff like this. And, they're expected to do stuff like this and get backlash, but they want to do it anyway. So he now went ahead to ask this question that he has been wanting to ask as a result of his professional stuff and his experiences in the GI and in the medical field and all of that. And when I asked, why is it that anytime black people comes around for medical examinations and all of that, they tend to come with the phone and they're often on call. If they were not able to come with maybe a partner, the partner might be a mother, a sister, a child, or even a father or a husband. And if they didn't come with these people I just mentioned above, they will go ahead to always be on phone talking to the said partner on phone. Maybe they're not able to make it up to the appointments with them. Now, he's asking this question, why is it so? Why are they doing stuff like that while him as a medical practitioner switch off his phone or put his phone on silent or even maybe keep his phone aside? But you as a black patient, you will decide to actually come for these examinations with your phone and other accessories just to be online, or maybe come with a partner if the phone is actually not available. So now the question is, why is it that he felt that he could ask this question if he don't already know the answers to this question? Because this man is a medical practitioner whom has actually been in this field for quite a long time, maybe years, months, it doesn't matter, but he has actually been on this field of professionalism. But he decided to ask this question without actually knowing the answer, or maybe he actually knew and he's tried to pretend as if he's not ignorant, or he's ignorant of the question he's actually asking black people. Now, since he's claiming not to know, which I know very well that he know the reason why this often happen. So far, he's a medical practitioner. He's a pan-colored person. So he should know the answers to this question. I wonder why he's asking this question. But anyways, he has asked the particular question, so we're going to give him the answer to it. The thing is that black people over the years have actually gone through a lot of trauma. They've gone through a lot of ill treatment. They've gone through so many things. They've gone through some kind of emotional and generational trauma. You can actually put it in any way you want. These people are practically every day of their life trying to be safe. They are living and trying to be safe. They are not comfortable. They are actually living the next day in a form of trying to be very careful of their steps, of the people they meet on a daily basis, because they are always the people that is of the target. Yeah, these people have gone through a lot. Not even today. It didn't start today. It didn't start yesterday. It started 400 years back. They have actually been treated so abnormally. And coupled with the fact that what has been happening in the medical, field and all of that, that has to also do with pregnant black women. If you watch, there are high rate of this. Actually, took to the record last year. That was when I actually staged stuff like this, where a high rate, or mortality rate was high in terms of black women. These black women are being treated so unprofessional. Will I use the word unprofessional, or will I just say that they are being treated lesser compared to the way a pan-colored person is being treated in the medical field? And this is something that has been there online, and most of these black women comes out to share their experiences. They try to call out for help. I think I posted a video, was it last month, of a woman or of something that has to do with a record that shows that black people that is treated by a black doctor tend to get better or tend to live longer, something compared to black people that is being treated by a pan colored person. The statistics of black people being treated by a black doctor, living longer life, recovering and all of that is very, very high compared to the other one. And it also shows that maybe far away in Africa, black people have been, because in Africa, it's definitely a black doctor. The population or the rate at which, unaliving stuff reduced compared to that of, compared with the way they treat these people. There's also a video that I posted where a woman, she is in need of a painkiller. She was calling out, yelling, crying. I can't even get it off my head. That was a video I posted last year before I took it down because of, this woman was just saying, crying and begging this painkiller nurse to give her a painkiller. But she was just ignored. She was crying until she went ahead to use her phone. This phone you're talking about. She went ahead to use her phone, go live. She was on live. She was recognizing on live, calling and yelling for them to administer a painkiller. But no, they chose to ignore her, telling her that she wanted to misuse it. But if this should happen to a pan-colored person, oh my God, their body does not endure pain. These people often think that our body, is very thick and we endure pain. Like we are meant to endure pain because of what we have passed through in the past, or because of what we have really, really passed through in the past. So our body is meant to endure pain. So this woman was calling, yelling, crying. She had to go online, but she was ignored. And after some weeks and days, this woman was, the end result of it. And that is it. And so many of these cases, in terms of childbirth, in terms of everything in the medical field, the way they treat people, black people like this, it's so alarming. And with all of these things happening on social media, people personal experiences trying to tell the world to watch out for themselves. You think that black people will be very comfortable coming to you for a medical examination, knowing fully well the way they have been maltreated and are still maltreating, to just come like that because they trust you. No, 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 no. They can't trust you because you guys have given them reasons and reasons and reasons not to trust you. So if you see someone of my own type coming to you for an examination with a phone or even a relative, you shouldn't come up online and start asking questions, or because you feel that you are ignorant or you are trying to pretend to be ignorant. We have internet. Check the high rate. Check. You don't even need to come here to try to receive backlash. It's all over the places. People with their personal experiences, they share it. Yeah, they do that because of their own safety. They do that because they are not safe. They don't trust you. They don't trust what you do to them. So it's best for them to actually come with someone in case maybe they're unconscious or something. Somebody will be there. In case they needed something, painkillers or whatever, somebody will be there to assist. Because assuming this lady that I talked about how she, her life was because she was crying, screaming for help. assuming she was attended to, or assuming she actually came with someone, maybe a partner, relation, child. Somebody could have, gone over there to the decks and dragged them to come help out. But this woman, she was in her room, she was crying, she had to crawl from her bed to the floor, going to that. Like, I cannot even take that off my head. But later on, when I tried to check back if she has really, I found out that she is not even normal. Like, she's normal. She have to crawl from her bed down to the floor, going to the reception to beg, cry. Somebody was practically crying for herself to leave. And you think that people don't know, or you think that people will be adamant, or you think that people will just close their eyes. Everybody's just trying to survive. Everybody's sick and tired of the way they've been treated, or because of what they are wearing in their body. People are tired, so you wouldn't blame them when they want to come out there with their spouse relations, because that's the only people that they can trust. They can't trust you guys. They can't. And you guys have given them thousands of million reasons not to. If we think that we have been aligned with you guys, that is when you guys hurt the most. And it's so heartbreaking that even in the medical thing, or in the medical section or sector, stuff like this still happens. What happens to the vows that you guys took? What happened to the promises before graduating, or before even trying to become this professional? I saw a video of some group of black doctors celebrating. Do you know what a pan-colored man have to do by stitching those videos? You have to, like, will you live your life in the hands of these people? Like, seriously? Like, seriously? What do you expect? When you become a dark person like me, and in a professional field like this, they become so jealous. But when you allow them to do what they want to do, they don't treat you so well. So what do you want black people to do? What do you want us to do? We are trying to save ourselves. We are trying to create ourselves. We're trying to do everything for ourselves, because we can't trust no one. The only people we can actually trust is our relative, friends, family, people like ours. Why is it that in a place where black doctors are, black people tend to like be treated well, but in terms of few people, no. You should just go ahead and ask your colleagues the question. Why is it that they do things like this to human beings? Anyways, lovelies, why not just leave me your own thoughts in the comment section of what you think of this video? And do not forget that we do not support any form of bullying, harassment, or whatsoever. We're just here for educational purposes. So please share this video, subscribe to this channel if you're yet to do that, and I will see you lovelies when I watch upload up to the this next one. extent. Thank you so much for all the love and support. Don't forget to please leave me your own thoughts in the comment section of what you think of this video. And do not forget that this channel, we do not support any form of bullying, harassment, or whatsoever. We're just here for educational purposes. So please share this video, subscribe, and leave your thoughts, and I will see you lovelies when I upload the next one.